Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
Good morning.
We're having so much fun.
I know we are. We're talking about second opinions, and it's so important. And Dr. Mencia, years ago, if you went to a doctor you really liked, you would never go for a second opinion.
Oh, it was an offense.
Absolutely.
It was an offense. You are offending me. You want a second opinion after I've been treating you for 20 years of my life? You are offending me. Out of my office.
Yep.
And patients will put their tail between their leg and walk out of there crying. Oh, my God. The doctor kicked me out because I wanted to get a second opinion.
But now you have become a second opinion doctor because you're so good at diagnosing. So people come to you and you give them a second opinion. Do you have to assure them that their doctor is good, but that I'm just going to add some of my experience and see what we can do to help, right?
Absolutely, absolutely. And, we get all kinds of referral to us. Sometimes by the parents bringing the kids. Sometimes the kids bring in the parents and they want to get a second opinion. And a lot of my second opinion comes to me from kids that want to know what's with the memory of the parents or the loved one. And when I go and I make the diagnosis of Alzheimer or make some other diagnosis that had been missed, like a normal pressure hydrocephalus, anything like that, the first thing that usually come out of their mouth is, oh my God, and we've been going to Dr. So-and-so for 30 years and he never said anything. And I tell the kids, let me tell you about your parents or your loved one condition. It didn't start yesterday. You also were missing it because you spent so much time with them that the memory is failing, but you don't even notice that the memory is failing. And you let it be, and it become part of your new norm. And the same thing with the doctor. The doctor go and spend 10 minutes with the patient, 15 minutes, 5 minutes, and they see you once a month or, God forbid, I hate to see geriatric patient being seen once a year. And it's very hard to assess anything unless, number one, you know what to look for. So as geriatrician, we are trained in neurological and psychiatric condition beside the general condition that a GP will follow. So we follow the same condition a general practitioner will follow, but then we go beyond that. That's what a geriatrician is. That's why we specialize in geriatrics. Then we are able to prevent and even detect other conditions in the geriatric population. But I tell you, and I had a young lady that was brought to me by the mother because the daughter wanted $40,000 to go to a special treatment, quote unquote, for anorexia. And she was saying, I'm bulimic, I am anorexic, and I need this money so I can go. And the mother wasn't too sure. And she listened to us on the radio, and she said, let me get a second opinion with Dr. Mencia. I trust him. And she never met me. I never met the daughter either.
Well, she knows that I'm so trusting, and they trust me, and then they trust you, and that's how it works.
But she had heard that before I became an MD, I studied to be a psychologist. So I have the training as a psychologist. So I look at the person and I, try to establish, why are you here? And she goes, well, I'm anorexic and I'm bulimic. So after I eat, I had to go and throw up. I say, well, how often you do that? She goes, I do it almost every time I eat, I go and throw up. I said, okay. So I said, well, we're going to have to do some blood tests. And she has some, what we call in psychology, schizoaffective disorder. It's not like a full-blown schizophrenic, but has some schizophrenic-like symptoms and also a little bit of manic depressive disorder. I said, well, she's probably going to need medication to help her out, and that's probably why she's manipulating the mom. But little did she know that there are certain signs when we examine the patient on a person that is bulimic. For example, when you make yourself throw up, the stomach content is acid, it's very acidic. And when a person throw up, the teeth get rotten in front because the projectile of the vomit will damage your teeth in the inside. And the other thing, how do we make ourselves throw up? We take a finger and we stick it in our throat. And those patients, they develop calluses.
Oh, this is
in the
amazing.
Finger, so you become a detective.
This is amazing.
So I go and I examine her finger and I say, oh, you have nice nails. She goes, oh, thank you, doctor. And she's a cute lady, she can be a model. Oh, you have nice nails. You go, oh, thank you, doctor.
But no calluses.
No calluses. I say, open your mouth. I look at them. Oh, your teeth looks beautiful. He say, oh, no, they told me I have a few cavities. I say, well, if you want a second opinion on cavity, I can send you to my dental department, which, of course, she refused because the model is there with her. And I did all her blood tests. For this young lady, all her blood test is completely normal.
So what's the problem?
She was manipulating her mom to give her money.
Oh, my goodness.
And, it was money well spent because he said, do I give $40,000 to my daughter, the love of my life, to go and do whatever she want to do? Or do I go and see Dr. Mencia and have a second opinion to see if there is something really going on? All her electrolytes, all the thing, her thyroid, her vitamins level. I mean, how can you be bulimic and throw all your food out and your B12, your folic acid, your liver, your kidney, everything is as perfect as can be. And when they come for the follow-up, I just told the daughter, I told her, the only thing I can tell you is that was money well spent from you by coming here. Wow. But I told her, you need to get her a psychologist or a psychiatrist because this is not going to stop. It can get even worse.
Well, this is a
But let's say what brought us to the topic of second opinion.
Yeah. That's what I was going to do because everyone knows I love my doggy Charlie, and Charlie's had this growth on his forehead, and it's gotten bigger. And I checked with the vet that I go to, and it was not cancerous.
But Charlie's not talking
getting
today.
Bigger. No, I know.
He's sitting there.
Oh, he's so
he's
good.
sitting on the floor.
Right. So it's getting bigger, and so I finally said to the vet, okay, what should we do? They said, well, we're going to take it off, but first we have to have an ultrasound to make sure that the heart murmur isn't very big. Okay, find out because he has to go to surgery. So then they said, okay, we're going to do a surgery. It means you have to bring him in at night, no water, no food, all day. And it was like $1,000. But I love Charlie.
We're going to put him under anesthesia.
Yeah, oh, absolutely. And I was really upset about that. But so Dr. Mencia came in, of course, last week. And I said to him, I tell him everything. I said, look at Charlie. And I showed him the little growth. And I told him what the vet said. He said, no, it looks like I could just that you could just have it taken off like that. Would you do it? He says, no, I can't. He said, I could, but I won't because I'm not a vet. And I said, but he said it didn't seem like it's a big deal. So I'm thinking about that. And during the week in all the rain, I made an appointment to go for a second opinion at the Carl Springs Medical Pet Center, which is huge. And I went there and lo and behold, the veterinarian looked at it and said, oh, I could zap it off. And within 5 minutes, it was zapped off.
Which is what I told you.
I know that. You told me that. Zap it off. And he is sitting here. Of course, he has this little cone on,
just
which he'll
to
have for
protect
1
the
week,
wound.
right?
Yeah.
For 1 week. It's healing. Now, that's what is the value of the second opinion. That's why we're talking about it now. Look.
And it's not the money.
No,
it's
wasn't.
Not the money.
No.
It is taking a dog like him.
At 10 years old.
At 10 years of age. That's a geriatric dog already.
Right.
Taking a dog like this and putting him under anesthesia. Why?
Right.
When it's something that you can fix.
Right.
It's like Richard was saying, he had an accident. Our control master over here, he had an accident and he went to the hospital with a really bad fracture of a finger. Would the hospital look and say, we're going to make money here. So the anesthesiologist come over to put him under. And he said, wait. You're not putting me under. It's a finger. For God's sake, you just give me local anesthesia. I'm driving home from here. And he stood up And they say, wow, this guy is not stupid. So, we are not making money out of him. So, let's do local anesthesia and send him home. So, you need to stand up for your right. And when you see something that doesn't sound right, get a second opinion. I have so many patients that come to me.
But let me give your phone number. Wait, because we're already 15 minutes into this. Okay. All right. So are you there today?
Yes, I am.
Okay, in the rain, he's there today. So this is down there in Fort Lauderdale on East Commercial Boulevard.
And my hygienist, Suzanne, is there today. I had to bring her over. You had to meet
hygienist.
Suzanne.
Oh, yes, that's right.
In dental,
It's the same one I met before, a different one. No, I met a lovely hygienist, but that's for dental. Let's just talk about second opinions. If you have something you're worrying about, go to Dr. Mencia. He will tell you the truth. He may tell you what the doctor told you is perfectly fine. Okay. And so their address is 1608 East Commercial Boulevard. It's on the south side of Commercial Boulevard. And the phone number, get your pencils out. It's 954-489-1345. Again, 954-489-1345. You can go on their website, which is agifl.com. And they do have home visit services available for homebound patients. Medicare and most major insurances are accepted. They have so many specialists in all fields. But okay, why don't you go?
Dr. Amy Raskin was broke ground. She broke ground at the Boynton office.
Oh,
she went
so
yesterday.
Good. Did she?
She went yesterday, and so
you had some patients.
She had patients there. She had a food.
She's
schedule.
a doll. She is just a wonderful woman. Yeah. Very well educated, great credentials.
I'm telling you, I'm so blessed with each and every provider that work with me.
Yeah.
It's a blessing.
Yeah, you're very good. So, okay, second opinions. So what about people who you have looked at?
No, second opinion is an art from the consumer side as well as from the clinician. You have to be a good clinician. You have to be a diagnostician to render a good second opinion. And you have to always think of the economic of the person. There is no need to go for a second opinion and spend whether Medicare money or private insurance or out of pocket. Spend a lot of money to get a second opinion. So to minimize the cost, what you need to do if you went to a hospital and they did blood test on you, get those blood results. And I had a self-pay patient that came to me yesterday for a second opinion. And I saw him, I initiated treatment because he was willing to be treated. You can go for a second opinion and you can say, well, I don't want to get treated. I just want to know, should I follow another path or am I on the right path for my care? So you don't have to accept treatment. But this person was willing to accept treatment from me. So I initiated treatment, but I told him to render a second opinion for you. Even though if we move forward now as patient and doctor relationship, I need to get all those records. He wasn't prepared. He said, I have everything at home. And I said, why are you here then? If you can get things to the doctor even before you go there, say, here, give this to the doctor, and then these are my records, and specify that you are not coming there to have those records just be scanned into the system, that you want the doctor to analyze it because you're coming for a second opinion.
Why did he have the records? Is it not typical that you would have to ask the doctor you are going to send the records for a second opinion?
No, because he went to the hospital, and when he went to the hospital, he was self-pay. So he requested, you can request your record right then and there, and they will either mail it to you or give it to you as you wait there at the hospital. So he went to the hospital and they did all kind of study. I said, I don't want to waste your money doing ultrasound and doing tests that you already have done. So I want to look at the study that you have done. Sometimes they could have done a CAT scan, but it was not with contrast. So it won't give you the information that you're really looking for. And I have a patient that came to me that he went to a well-known memory center in Broward County. And the neurologist, now this is a specialist, the neurologist told the son, your father is going to be too much for you to take. And, the son is is working full-time. He's a lawyer, well-known lawyer, so he's very busy, travels a lot. And the neurologist said, your father is working, you're working full-time, your father is going to require a lot of assistance. He doesn't have long-term insurance. My recommendation is at this stage, put him in a nursing home or an assisted living facility. And he's going to be safer there than staying at home. And the son was heartbroken. And this is before I started doing radio show and all this thing. He called the American Geriatric Society, and they referred him to me. So he brought his father in. He brought the record. Very, as a lawyer, so he come very well organized. And I said, there's something missing here, because your father have declined in the past 4 months, and I don't see a CAT scan of the brain.
Really?
And he said, well, I asked the neurologist. He said, we don't need one because we done one 2 years ago and there was no cancer. If that's what you're looking for, he had it done and it's there in the record. I said, no, it's too old because this happened in the past 6 months. Now, the symptom is a classical triage. Anybody in a good medical school or anybody in a good geriatric or neurological center know the triage. So a sudden decline, that's key, that presents with memory decline, urinary incontinence, unable to walk. And I say this is classical of MPH, normal pressure hydrocephalus. This is as classical as it gets. The guy was able to walk, has a little memory decline in the past, but he was able to walk. He was controlling his urine very well. But now he's on a wheelchair for the past 4 months, cannot retain the urine, he's on diaper, and don't recognize anybody. Do not recognize the son or anybody. Me, I couldn't expect anything because he meeting me for the first time. But he didn't know he was in a doctor's office.
Really?
If I ask him, where are you now? At the airport, at a doctor's office, or in a supermarket? He said, at the airport.
Really?
Said, okay, with a white jacket on and everything. That was 20 years ago. And I told the son, you know what? I know what your father has. And I tell you something, he does not belong in a nursing home. Now, this top-notch lawyer look at me with my ponytail 20 years ago. I look even younger. He looked at me, and he's 7 foot tall. And he looked at me like, you know what you're talking about?
I love this.
And I said, let me tell you something.
Oh, my.
If you want to help your dad, take him straight to the hospital. Get this CAT scan done of the brain that I want. Tell the radiologist to read it while you are there, not to let you go home, and to call me to let me know if I'm right or wrong. The guy is calling me himself. He said, Dr. Mencia, I'm sorry. I'm really, really sorry. I think you're right. The radiologist's eyes like $2.50. And he's looking for your number to call you. I said, give him the phone. Just put your phone. So he gave his cell phone to the radio. He said, hi, this is Dr. Mencia. And of course, they recognize the lawyer. They look at him and say, oh my God, look who's here. So he take the phone and he said, your patient has normal pressure hydrocephalus. I said, okay, don't move. Send him straight to the ER. I'm going to admit him now.
Tell people what that is, though.
Normal pressure hydrocephalus is when, the brain is backed by fluid. So when they put a needle in your back and they do what we call a spinal tap, we're taking some of the fluid out to analyze it. When a person have meningitis or anything like that, we're analyzing the fluid for infection or inflammation. And so that fluid is produced in a cisterna that we have on each hemisphere of the brain, in the center of the brain. So the brain, you have all the brain going around, and in the center, you have these two cisterna that produce fluid. And then that fluid, because it's in the middle of the brain, need to come out and then go around the brain and around the spinal cord. So you have little windows that allow that fluid that is being produced by gravity just fall down, and it goes down into the spinal cord. It goes around your brain. And what happens, sometimes those windows, as we age, they can shut down on us. And now the fluid doesn't stop production.
So where does it go?
It keeps pushing the brain, because the brain is a sponge. So the cisterna will get bigger and bigger and bigger. So imagine you blowing a balloon that is surrounded by a sponge. The sponge gets squeezed against the wall, which is the skull. So the brain gets squeezed, and you cannot think. You cannot control your urine. You cannot control your poop. You cannot walk. Your leg feels like lead. So, you are basically paralyzed. And the sooner you solve the problem, the faster the recuperation. So I call right away my neurosurgeon. I say, I have a case. It's a VIP case. I mean, the guy was just there by insurance. But just because it was who he was, and it was a very good case, and I was just starting my practice, and it was going to make me shine like better than the sun. And I said, I'm going to go all the way with this case. So I called the neurosurgeon and said, can you meet me in the emergency room? I have a very important person that I need to undergo surgery. And he asked me, well, how long does it take you to do the medical clearance? How fast do you want it? Is the question. He said, man, you good, man. We'll meet you there. So we met there. I drew my blood. I got my thing done. I rushed everything. Start this, start that. Start x-ray. I already done my EKG in the office. Fax me my EKG. Fax me what I got there. We got the patient in the same day into the operating room. We both, the son and I, stayed by the bedside because this is a very important case. This guy went to a very high end. Some people go, oh, I went to the Cleveland Clinic and they said that I had this. I don't care what they say. I want to know what I think. If I concur or I disagree. You can go to Mayo Clinic. I don't give a damn. I want to know that what my opinion is. My clinical opinion, either concur or disagree. Some people get frightened when they hear, oh, the Mayo Clinic said this. No, it could be a student at the Mayo Clinic saying that.
Of course.
That doesn't mean anything in today's age. Those are teaching institutions. So the guy wake up from anesthesia. And this is now, it's about 8 o'clock in the evening. The patient wakes up and he asks me, who are you? And I say, oh, I'm Dr. Mencia. You know who this person is? They say, of course, that's my son so-and-so. Oh, the son start crying. I say, oh, my God, he recognized me. So the wife, the wife of the son comes in, the kids come in. He's recognizing everybody, calling everybody by name. I cry because I say, oh, my God, this is so crazy. This is, look what we have done. We have taken this guy that could have gone into a nursing home and died because they stopped eating.
Of course.
They stop eating. They develop ulcers because, malnutrition. They get dehydrated. They become frequent flyers to the hospital, and then they go into hospice and die. And this guy came back to life.
So this is the whole idea of a second opinion. It's a perfect case.
It's a Jewish family, so the next day they bring me a huge basket of fruits. And they say, thank you for returning my father to me.
That's a beautiful story. And I know you've been in practice a long time. You've probably had a lot of stories like this where people, first thing is they're going to send the person to a nursing home. They're going to do something. When if they just would get a second opinion, they might find it's true, but wouldn't it be nicer to know? I have to say now, and I can't do anything about it, but I should have, and I just say this, before we have to leave, that I should have gotten a few second opinions on Bill. It's too late, and I thought I was getting the right things done, but it's taught me a big lesson. My dog has taught me a lesson. I mean, it's second opinions. You got to do it, and you just, don't be afraid of the doctor being upset. It's your life, right? It's your loved one's life. Well, Dr. Mencia, as usual, you're wonderful.
Oh, no.
Yeah, we're over. But
Rachel, don't kick me out.
It's 954-489-1345.
I can breathe, Rachel. Let me go.
I hope that enough people have gotten the message about second opinions. This is the Second Opinion Show.
It's your right.
Yes, it's your right, and it could save your life. Thank you, Dr. Mencia.
Thank you, Anita.
We'll be right back. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
AGI Medical and Dental Centers wants you to receive the finest and most personal medical and dental care in South Florida. Founded by geriatric physician Dr. Andy Mencia. They combine comprehensive and diagnostic medicine while providing personalized medical care for each patient. Now in 2 locations, Fort Lauderdale and Boynton Beach. Their medical staff is trained and dedicated to utilize the latest medical cutting-edge technology, along with listening skills to provide their patients with the best medical and dental outcomes. Here's some of their unique services. Second opinions for peace of mind and assurances of outcomes. Dental care by prosthodontists and periodontists, from the simplest oral cleaning to a full implant program. Medical professionals visiting and caring for patients who are homebound. Saturday office hours. Go to their website at agifl.com. Be sure to listen to Dr. Mencia and Anita Finley on The Wonderful World of Wellness each Saturday morning from 7 to 7:30 on WSBR Radio, 740 on your dot. To become a special patient, call AGI Medical and Dental Centers at 954-489-1345 in Fort Lauderdale and 561-270-6494 in Boynton Beach. Medicare and most insurance accepted.